Ever feel like you're literally flushing valuable info, like right down the toilet?
Okay, that's a visual, but I see where you're going with this.
Today, we are diving deep
Deep.
into the fascinating world of pee.
I was going to say urine, but yeah, pee works too.
As a health indicator, your pee, believe it or not, can tell you a lot.
It can. It really can. But full disclosure, we're not doctors.
This is for informational purposes only.
If you're concerned, see a medical professional. Don't just rely on, your toilet bowl observations.
Exactly. But let's talk about what's normal, right?
Yeah.
When you glance down, what's the color that says all good?
So most people know pee is yellow, but there's a whole range of normal yellow, from like super pale, almost clear, to a deeper yellow.
Okay, so light yellow, we're good. What about when it starts getting darker?
Darker yellow, especially if it's heading towards like amber or honey, that's a sign you need to up your water intake.
Dehydration signal. Got it. Now, this has happened to me, and I always wondered, what about when your pee is almost like neon yellow?
Ah, yes. That usually comes down to excess B vitamins, specifically B2, also called riboflavin.
So, if my pee could glow in the dark, I might be overdoing the vitamin supplements.
It's possible, not necessarily harmful, but your body's basically saying, I can't use all this, gotta flush it out.
So a waste of vitamins, basically.
Yeah.
Okay, now for the colors that really make people wonder. Blue or green pee, is that ever, like, normal?
It can be. Sometimes it's just from food. Some food dyes can do it, and asparagus is a classic culprit.
Wait, asparagus can make your pee BLUE?
It can for some people. It has a sulfur compound that breaks down and can tint the pee.
Wild. But if it's not the asparagus and it's consistent, what then?
Then it's worth checking with your doctor. It could, in some cases, be a bacterial infection, though that's rare.
Good to know. Now, the colors that really freak people out, red or pink, is that always a reason to panic?
Not always, but it can be. Sometimes it's harmless beets, blackberries, some medications. Those can all cause it.
Okay, so not an automatic ER trip.
But if you see red or pink, it's best to get it checked out. Could be a UTI, kidney stones, or in rare cases, something more serious.
Like the bladder cancer, right?
Exactly. Don't ignore it. Now, even darker brown or black, those sound, I don't know, ominous. They can be concerning. Brown sometimes means severe dehydration, but it can also be linked to liver problems.
So, like, if your liver isn't working right, brown pee could be a sign.
Yeah, when the liver's not functioning as it should, a pigment called bilirubin builds up and gets excreted in the urine, giving it that brown tint.
Okay, brown pee, definitely take note. What about black? That sounds, I don't even know.
Black is very rare, usually caused by certain medications or a rare genetic condition.
If I ever see BLACKP, I'm calling 911.
Immediate medical attention, absolutely.
So, big takeaway, temporary changes in pee color. Probably no biggie. Food, supplements, those can cause it.
Right.
But anything persistent, especially those red, brown, black colors, see a doctor.
And honestly, staying well hydrated solves a lot of potential issues. Just drink enough water.
Great advice. So everyone, next time you're in the bathroom, take a peek. Your pee might be trying to tell you something.
It makes you think, right? What other everyday things are we ignoring that could be giving us clues about our health? There's so much to learn if we just pay attention.
That is a great point to end on. Food for thought, folks.